Any infection that affects any part of the urinary system is known as a urinary tract infection, UTI. The kidneys, ureters, bladder, and urethra are all parts of the urinary system. The majority of infections affect the bladder and urethra, which are parts of the lower urinary tract. Compared to men, women are more likely to get a UTI. An infection that only affects the bladder can be uncomfortable and bothersome. However, if a UTI spreads to the kidneys, it can lead to major health issues. Causes. The most common UTIs occur mainly in women and affect the bladder and urethra. Having sex also may lead to a bladder infection, but you don't have to be sexually active to develop one. All women are at risk of bladder infections because of their anatomy. In women, the urethra is close to the anus, and the urethral opening is close to the bladder. This makes it easier for bacteria around the anus to enter the urethra and to travel to the bladder. Infection of the urethra. This type of UTI can happen when GI bacteria spread from the anus to the urethra. An infection of the urethra can also be caused by sexually transmitted infections. They include herpes, gonorrhea, chlamydia, and mycoplasma. This can happen because women's urethras are close to the vagina. Infection of the bladder. This type of UTI is usually caused by Escherichia coli, E. coli. E. coli is a type of bacteria commonly found in the gastrointestinal, GI, tract. But sometimes other bacteria are the cause. Symptoms. UTIs don't always cause symptoms. When they do, they may include a strong urge to urinate that doesn't go away, a burning feeling when urinating, urinating often and passing small amounts of urine, urine that looks cloudy, urine that appears red, bright pink or cola-colored, signs of blood in the urine, strong-smelling urine, pelvic pain, in women, especially in the center of the pelvis and around the area of the pubic bone. Risk factors. UTIs are common in women. Many women experience more than one UTI during their lifetimes. Risk factors for UTIs that are specific to women include female anatomy. Women have a shorter urethra than men do. As a result, there's less distance for bacteria to travel to reach the bladder. Sexual activity. Being sexually active tends to lead to more UTIs. Having a new sexual partner also increases risk. Certain types of birth control. Using diaphragms for birth control may increase the risk of UTIs. Using spermicidal agents also can increase risk. Menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract. The changes can increase the risk of UTIs. Prevention. These steps may help lower the risk of UTIs. Drink plenty of liquids, especially water. Drinking water helps dilute the urine. That leads to urinating more often, allowing bacteria to be flushed from the urinary tract before an infection can begin. Try cranberry juice. Studies that look into whether cranberry juice prevents UTIs aren't final. However, drinking cranberry juice is likely not harmful. Wipe from front to back. Do this after urinating and after a bowel movement. It helps prevent the spread of bacteria from the anus to the vagina and urethra. Empty your bladder soon after having sex. Also drink a full glass of water to help flush bacteria. Avoid potentially irritating feminine products. Using them in the genital area can irritate the urethra. These products include deodorant sprays, douches and powders. Change your birth control method. Diaphragms, unlubricated condoms, or condoms treated with spermicide can contribute to bacterial growth. Before you decide to take any medicinal herb or herbal supplement, be sure to consult with your healthcare professional first. Avoid self-diagnosis and self-medication, always be on the safe side. Subscribe, comment and share to save someone's life.